personal protective equipment, rather known as PPE. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against infectious materials. It is also called as barrier precaution, which refers to a variety of barriers and respirators used alone or in combination to protect mucous membranes, airways, skin, or clothing from contact with infectious agents. The protective equipment includes but not limited to the use of gown, mask, goggles, and gloves. PPE equipment should always be readily available in all departments to all healthcare workers. Steps on putting on your PPE. When the healthcare worker has decided which equipment to use based on the situation it is exposed to, he is now ready to put on his PPE. But it should be always first started with hand hygiene, either with the use of soap and water and an alcohol-based hand rub, followed by putting on gown, which should be fluid resistant that covers your clothes and any exposed skin. It should be long enough to cover you from neck to knees and your arms up to your each wrist. Tie down the gown at the back of the neck and at the waist. Next is putting on your mask. Secure the ties or elastic bands around your head so that the mask stays in place. Fit the flexible band to your nose bridge and ensure that it fits snugly to your face and below your chin. Discard mask once it has been worn. Do not hang on the neck or keep on the pocket. Use particular respirators such as N95 for airborne precautions. Eye protection or a face shield is to follow. Face shield must cover the entire front of your eye and extend completely along the sides. Prescription eyewear alone does not qualify as an eye protection. The last thing to do is by putting on your gloves. Gloves must be clean, durable, chemical, and tear resistant. They must be long enough so the cuffs of the gloves cover the cuffs of the gown. Ensure that your skin is not exposed at the wrist. Gloves should be changed in between patients. Examination gloves are not appropriate for cleaning and sterilizing medical equipment. Thus, general-purpose utility, rubber, heavy-duty gloves shall be worn by maintenance, housekeeping, laundry, or non-medical personnel. It may be decontaminated and reused if the integrity of the glove is not compromised. Thank you for watching a review on personal protective equipment and donning your PPE.